2016 is being called the year of the healthcare hack. From your vantage point, how vulnerable is the healthcare system in the US? And what are you doing at Carolinas to protect patient information while still allowing that patient information to still flow? Because obviously that's a very unique paradigm compared to other industries.
Yeah, it's a challenge. It's a challenge not only for healthcare, but it's a challenge for all the industries. And so what we've seen is a lot of examples are non-healthcare, intrusions that has taken place over the last several years, and some of the hardship that causes when that happens. And we look at the medical record for our patients, that actually is a product or that is much more valuable in the black market and something that it needs to require that kind of protection. So what we're trying to do is actually set policy as an industry, and try to get the proper public-private relationship in place. Certainly, if you take a look at other types of intrusions that would take place from a physical perspective, there's things that I don't have to worry about. I don't have to worry about somebody sending missiles over to our healthcare system and bombing it. There are other things that the company or that the nation does nationally to protect us and our borders. Unfortunately, the way that information systems are built and the way that the internet was devised is to be shared globally all the way across. So you got nation states and other people with other initiatives wanting to come in, or for other reasons wanting to come into us and grab our information. So now you're starting to see separate agencies within the government share information and to make that information public to us, so that we, as a secured provider or protector of that information, now have more access in order to do so. There's nobody within our industry that wants to see a hack or any type of intrusion take place. So this is something that we're not competitive about, but we're actually trying to collaborate on, because what we want to do is ensure that the patient's information is certainly protected and they entrust that information to us to protect it. So no matter what different provider that patient does go into, the intent is that we can all have some level of standards that allows us to be able to protect the information for the benefit of the